and she's not gonna leave. And I told her to keep checking on it.
Okay, thank you. And we're trying to work on switching rooms. We have a room, and it's 371 versus where he's at. That room has piped in oxygen through the wall, and when people are on that high of a level, we really need to use that because they'll run through those tanks quickly. So the lady that's in there right now, she's at a doctor's appointment. So when she gets back, I've got to see if she'll move, which I think she will, just for a few days because she's going to be leaving anyway. But I've got to explain, you know, that I need that for the oxygen. So we're hoping to get that done by the evening. I'm thinking she should be back by 3:30 because I couldn't move her without her consent. But if she does move, we need to move him to 371 so that we don't have to worry about his tank's not getting changed out and somebody forgot to go check. That's a continuous flow through the wall. Okay.
So he was on 8 liters when I was in there just now. Is that, has he been on 8 liters all day?
That I don't know. I'm sorry.
I'm Rena, and I'm the LPN. I'm representing the nursing department.
Okay, thank you.
Yeah, it's hard to pull the nurses off the floors. So she does wounds and falls and things like that, and a high risk, she looks at risk that patients are at. So she's a little bit more flexible to come to meetings to represent nursing, to see if there's any nursing questions. But, you know, she copies a list of his medicines in case y'all have any questions. And if there's some concerns, you know, she'll address that with our physician or nurse practitioner. So she's helpful in that area. Although Rena's not direct care, but she does that. So, and then our full-time dietitian is not here for this appointment, but she said she talked to, is it you? Are you the son?
I'm the son.
Did Amber, the dietitian, talk to you yesterday? I thought she said she had talked, or she might have just talked to Mr. Rowan himself.
I think she talked to Mr. Rowan.
Did you get an update from her?
Letter.
Okay.
She had an appointment.
Okay. Did you talk to her before she went?
I talked to her, but she said she had turned everything in the progress note, and if they had any questions, they could
Okay.
feel free to call her.
And I'll let you do that too. But let me go ahead and start with Jo. She is his occupational therapist. We'll just kind of go over what we're doing for therapy, and then Rena will touch base on the nutrition and any kind of nursing care.
And we're going to have a doctor or a nurse practitioner?
They don't come to these because we do so many, it's hard to pull in.
Okay.
If there's any concerns, otherwise there's dictation for the chart about him. If there's something we can't answer, we'll take that to them.
I would like to know the first time that Dr. Lowry saw
Okay,
Jim.
well, we'll get to that, and let's go ahead and do therapy first. While we do it, so she can go back and do
And my name is Jo. I've been working with Jim as far as occupational therapy. I've been working with upper body strengthening, and, you know, sometimes standing if he can tolerate it. Last week he was doing well. I mean, he works hard too. He does, and then the first, I think Monday, he's starting to get weak because I think he's got pneumonia. He's developed pneumonia, and I don't know. I keep asking him what did he eat for lunch because he's getting weaker, and he couldn't eat, and that's the reason why. You know, if you don't eat,
But he
you get
came
weak.
in with pneumonia.
Yeah. So, but now, yesterday, he was on 4 liters of oxygen when I worked with him. He was on 3, and then yesterday it was bumped up to 4. And we've been doing sitting. I could not do standing because his oxygen, every time I check it, it goes down whenever we do some, you know, he says, not really excessive, but, you know, the more pressure he does, the oxygen goes down, so I'm just taking it easy right now.
When you say goes down?
Like yesterday, it went down to 88, 89.
Oh,
It goes up to 91, 92, 4 liters.
When he sits to rest.
Yeah, when he's when he sits to rest. Of course, he's still non-weight. Don't touch weight bearing on that. So.
Yeah, Wendy's his normal physical therapist. She's out for 2 days. And she's like, let's have a meeting. And then she's like, Kim, I won't be here. I'm like, you want to have the meeting?
Yeah, that's why.
But anyway, she was going to talk
Yeah,
to Joe
I
too, so
touched
she
base
can.
with her, but
Mhm.
we're both the same,
But he's not gonna be able to perform very well in therapy as long as he's,
He was doing,
Physically,
yeah, he
yeah.
was doing well last.
So he's on 3 days of getting a shot of, what was the name of it?
Rosectin, yeah.
So, obviously, we're gonna have to work through this hurdle right now, because that is gonna, unfortunately, that happens sometimes, that we have to look at the medical issues to get back to the rehab progression. So we gotta fight this battle, and then go, and then hopefully get to Dr. Cavino.
But prior to his shot yesterday, what type of antibiotics were they giving him for the pneumonia?
Well, I'm gonna have Rena do all the nursing, because that's
Right now,
Okay.
he's taking the Rosectin, which is an IM injection, and he's on it
Right.
for 3 days.
What were we doing before that?
For that,
He came in with some instructions
Y'all have any
of
other
it.
questions for Joe?
No,
Yeah.
thank you.
Okay, thank you guys.
And I want to know when the antibiotics were stopped and by whose authority.
with antibiotics, let's see, they have to have a stop date usually, or if we don't have a stop date, we're looking at C. diff and other things with antibiotics. Let's see what order he came in with. He was in on the 20th of April. Let's look at his admission orders from the hospital. Okay, came in on the 20th of April. He came in on the 20th with Levaquin, 1 tablet by mouth daily. And we had to have a stop date for the pharmacy. Every antibiotic has to have a stop date, unless it's macrobid. And the only antibiotic that's usually used as like a prophylactic is macrobid for UTIs and stuff like that. Let me see something.
As I said, while you're looking there, I want to know the first date that all the dates that Dr. Lowry has seen him.
Okay, well, yeah, he came in with the Levaquin, 750 milligrams. He did not have a stop date. Let's see when they stopped it. I'll go back to the 20th. See what was written. He was seen on the 21st because they had a whole Coumadin. Okay. His last dose of Levaquin was on the 25th.
They didn't retest for pneumonia.
Yeah, he had a chest X-ray for that.
6 doses. 6 doses of Aleve. Well, I don't know what time he came in, if he got a dose here on the 20th.
It just depends. Let's see what time they have him coming in. I'm sure he should have got it at the hospital. Usually they give it in the mornings at the hospital. But depending on what time he got here, they usually give my lady a report whether he's had it or not. And it's usually 7 days. So I don't know how long he was on it in the hospital. These are the orders we got that he was taken in the hospital, because he could have been in the hospital the whole time he was there.
Getting 11,
Getting
from
11.
day one.
Yeah, but
Well, he was getting IV antibiotics before
okay.
that.
Well, when he came here, it was 11. They discontinued it on the 25th. Last dose of Levaquin on 4/25. His X-ray was ordered on the 14th. Sound about right, because you want to give it kind of 2 weeks because he had been on the antibiotic.
The 14th, which was yesterday.
Yeah.
And what was the report finding on the first X-ray?
It was compatible with pneumonia, upper lobe.
Bilateral? Well, it was only on the right one. We didn't have it before.
It was compatible with pneumonia. Now, to get down to all of this, we'll probably have to talk with the physician because I don't quite understand all this lab and compatible because there's ways it can be pneumonia. If the labs add up for CBCs, the white blood cells, or it could be addis collectis, it's ways that they do that. And right here is a history of pneumonia. Oh, no, history of pneumonia with right upper lobe and right lower lobe. He had infiltrates on 4/18 from Methodist Medical Center. So, yeah.
So that's the new report. Is that the one from
Yesterday.
That's the report from yesterday.
This is the report from yesterday, but it looked like he had, while he was at Methodist, right upper lobe and right lower lobe.
Right. So now it's in both.
Quite sounds
lungs
small,
and the upper
large,
lobe.
malpatchy, bilateral, predominantly both upper lobe and left lower lobe. Left lower lobe and both upper lobes, compatible with pneumonia.
So before it was all on the right, now it's all in the left and still in the upper right.
What it sounds like. And now what are they doing now? They're doing the.
Rosef and IM
Okay.
guys.
Did they do a culture, sputum culture before starting antibiotics?
We don't usually do the sputum culture before starting antibiotics,
So how do you know that the Rocephin is going to be?
because they're gonna do
effective?
follow-up chest X-ray, just like they did with this.
But I don't want to wait 3 weeks, because it's been 3 weeks since he had an X-ray, since he had the last dose of antibiotics.
There's a certain time that you have to wait once he's been on antibiotics, because it will interfere and then we'll get a false reading.
I realize that, but if whatever is causing his pneumonia is not sensitive to the Rocephin, then we're wasting time. That's why we usually do a sputum culture before starting antibiotics to know.
What's it sensitive to? I can put that on the doctor's board. I don't handle things like that. I don't handle that part of it. I don't make that decision whether he does sputum cultures and all that. He's usually pretty progressive with the pneumonia. We've rarely had problems where it comes back like that.
He
It
just
depends on the
documented
patient.
today. Did he say anything, like we ever thought with his documentation about seeing a pulmonologist?
Because the sputum culture in the hospital was showing yeast, which is a fungus, and I don't know if Rocephin's broad spectrum enough to.
Well, his mouth has been so bad that he couldn't eat, and.
Yeah, he's getting that nystatin.
Yeah, but there again, it wasn't until we demanded that he get that medicine. I want to know where the doctor has been.
Wait a minute. Let me go get somebody else for you.
I want to know when he
don't
called
know.
on him and what response.
'Cause I'm not able to answer
Yes.
those kind of questions. Maybe
Let
Dr.
Rena
Long,
work
let him
on
defend
that.
himself.
Okay.
Yeah.
Okay. Nobody can get the right answer.
Yeah.
Let's see what's going on.
There should be a
But sometimes,
record.
well, but we
In
want to
there.
get the right people to,
'Cause we have
obviously y'all have
doctor
some
boards.
concerns, so we'll make sure we're all on the same page.
But there should be a record in there of the doctor, it should be a separate record of the day that he called on him, of what he found there and what he prescribed.
Looks like he was seen today, so we'll have somebody go over that. And then we
Do
have
you
nurse.
realize this is the 24th day he's been here?
Well, and we have nurse practitioners that work under Dr. Lowry. It looks like they've seen him several times.
Absolutely, and he has completely disintegrated the whole time he's been here.
Okay, let's
His
get
weight
her.
has gone down. Nobody did anything about nourishment.
Hard to read people's writing.
What have you people done about the weight loss? You certainly kept a record of that.
Yeah, and there's a
And
note from
giving
the
him
dietary
nourishment.
in here, the dietitian, let's see if I can read her writing. Like I said, we all have pieces of slice of pie to his care, so I'm not medical, but I can see what she's written. That's why I want to get somebody in here that can answer the questions. Let's see, she made a note yesterday with a consult. The full-time dietitian wrote, patient has with poor appetite. He's of course has a weight loss.
20 pounds, that's
Down 21, 11.4% since admission. So yes, that's a big flag. Edema, bilateral BLE/BUE. See, I don't know what that is. I don't know what that is. Status post-hip fracture, diuretic, weight loss expected related to fluid. Will provide Ensure milkshake daily
Seen
in
that.
the evening. I don't know, will
We
he
can
drink
bring
those?
that ourselves.
Never,
Okay. Is he drinking those
We
at night?
never have seen one.
Okay.
I've been bringing
well,
him
she
shake.
ordered this yesterday,
Yeah.
so you should
On
start
the
getting
24th day of his being here.
514. We'll provide interim, okay, so daily, that was yesterday. Patient reports, son brings in supplements. Okay.
Is there a section for physician progress notes so we can see the dates?
Well, let me,
Dr. Lowry is
I'll
there?
wait till somebody comes in, but I can tell you he documented today. I'm not gonna lose note because I can't read it. I'm not saying he's probably may have seen sooner. I'm just saying he documented today. So let's just kind of hold off till other people come in because I'm not gonna be able to. I understand the frustration. I definitely do. I just want to get the right people in so we can all get on the same page about his care. Nurse practitioners saw him yesterday and ordered the Rocephin. And let's see. Okay. And that was all yesterday that nurse practitioner's done. Nurse practitioner saw him on the 13th. There's 5-6 by the nurse practitioner. Five two, nurse practitioner. Let's see.
Along your records, the only doctor that you will see that has called on him was the podiatrist that came to cut his toenails. He has had no medical care.
There's a nurse practitioner on 423. It's hard to read their writing, that's what's the bad part. Dr. Lowry dictated an H&P on 422. He said patient seen / examined.
That was this
The
week.
intake.
Yeah, and usually, because like what I try to tell people, you know, like Dr. Lowry is on call 24/7. Of course, it's not like a hospital. He doesn't do daily rounds with the patients every day. He does carry the caseload, but he does like to see his patients within a couple of days after they're admitted, because what he does, everything we got from the hospital, he sits and reads, because he wants to know why is this patient here. So then he'll do his examination, dictate. He normally doesn't go back unless he relies on the nurses or that nurse practitioner, because we utilize the nurse practitioners a lot, because his main goal is he gets those new patients admitted and seen. Then we have 2 medical nurse practitioners that they can do a lot of things on his behalf, but they definitely, you know, if there's some concerns, they work with Dr. Lowry every day. And so he may give them an order and they write it. So that's where, because most facilities do not have a full-time medical staff that we do. If you went to other healthcare facilities, the medical director comes in once a week. So Dr. Lowry's well, he's seen the 100 patients that are here.
But ours is
well, he did
important to
his
us.
initial visit, but I mean,
No,
like I
he
said.
didn't. He hasn't been there.
Okay, well, I'm just telling you what's in the chart. But then the nurse practitioners have done the visits. But, you know, but if he relies on those nurses and he keeps the doctor's board. If that nurse says you've got to go in there and see him, he does it, because he relies on what the nurses are reporting to him. Okay? Or, like I said, the nurse practitioners do some of the ring visits after that first initial visit.
After the episode last night with his heart, was the doctor called?
Well, I'll have to wait till somebody comes in. I just don't have those answers for you.
Did you say that
I'm
you
not
saw
sure
my
what
father?
Rena's doing, but,
Did you say that Dr. Lowry saw my father today or yesterday?
well, he made a note today,
Today, okay.
and then after he came in, let me see, I don't know if he said seen and examined, he may have just wrote some orders.
But they were debating last night of whether to take and call the man and have him sent to a hospital. Is that not a good time to see the doctor?
Well, it just depends what time they call. I mean, he's
Well,
only.
it depends on whether
Yeah,
they're
I mean,
living
he's
or
on call
dying.
24/7, but
Well,
He in the building today?
he is.
Okay.
I'm not sure what Rena's doing. She's probably trying to find somebody. Let's see.
I don't think he can pick Jim up out of a lineup.
Well, and I mean, really for the rehab center, you know, he does his initial visit, and usually that's the only visit unless there's other things going
but
on.
if they're sick and they're
Right,
brought
well-
to an assisted living home, aren't they supposed to be assisted?
Well,
If the family is supposed to do it, then we might as well have had him at home. We would have certainly given him better care. He has had one shower in 3 weeks. We have done all of his dental work. We have done all of his shaving. He has had no grooming whatsoever.
Okay. Would y'all care if I go see what's going on so we can get the right people in? Okay. I'll be right back. I don't know where Rena's doing or where she went, but I do want to make sure we
I
all know what
want
we're
to
doing.
see
Sure.
the doctor.
Okay, I'll be right back.
That's who we need to see.
Okay.